with healthcare, a lot happens that causes things to, and just like with any industry, a lot of things happen to cause the demand and the supply to change. Now, if per capita income falls, people are making less money, healthcare spending must go down as well. Same if it goes up, spending must go up. But this is not a quick adjustment. All right. Within healthcare, there's a very, very slow adjustment to any change. And individual decisions, they're easy to adjust, but the large scale, the macro adjustments, it's not. Any changes within insurance or policy, it takes a lot of time. So on average, it takes about 1 to 5 years for the healthcare industry to adjust to some shock, some different expectation. And the reason why is because new policies, right, they take time to A, get passed, and B, get to take effect. And for example, if there's a big jump in demand for medicals or physicians after the Affordable Care Act was passed because more people had insurance, but it takes time to get new physicians out there because of the time with medical school and the constraints with it. So when it comes to adjustment, the clerical, the maintenance types within hospitals, they're the quickest to be able to be adjusted. Then you have the nurses. It's a little bit tougher to get to add or subtract nurses because of training and because of the union rules with it. And the slowest when it comes to the professionals to adjust is going to be the physicians. Because again, they take a long time to get through schooling. When it comes to adjustments overall, hospitals tend to take about 2.7 years. So when something happens, some sort of a shock that causes a change in demand or supply, it takes hospitals about 2.7 years to adjust. Physician services, about 2.5 years. Spending on drugs, about 1.3. And the longest adjustment is with construction, which is about 3.5 years. So with construction, it's not only the building part of it, but also the financing, the permitting, so forth. So with this, looking at these adjustments, we're going to break down the permanent income hypothesis and adjustment to healthcare spending, adjustment to inflation, and adjustment to GDP and times. So the first is the permanent income and adjustment to healthcare spending to GDP. So this looks at the recession period, which began in late 2007. And you can see that these are the rates of growth for total employment and for health employment. So total employment started to slow and then decline rapidly starting in 2008. Healthcare employment, however, did not, and it stayed pretty consistent. So with these low adjustments of healthcare to changing, the losses were not seen. During these downturns, Medicare and Medicaid, which are being paid by the government, they're still being paid. So these people still have insurance. And additionally, workers who lost their jobs, yes, some may have lost insurance, or they may have become eligible for another program like Medicaid or maybe Medicare in some cases, or they could have gotten COBRA, an extension of their current. So there's a lot of ways they could have kept insurance. And so demand for healthcare remained strong during this period. Now, this clearly created a balanced budget problem when it comes to the federal government, because what happens is as people are losing jobs down here, that's people are making less income, and so that's less taxes being paid. And so if you're looking at a balanced budget, this is the balanced budget. Right? Here's the expenses, what the government's paying out. Here's the revenue that's coming in through taxes. Well, during a recession, the revenue goes down and the expenses go up. Now, it goes up for a lot of reasons, but part of it, as it pertains to healthcare, is that more people may become eligible for the federal plans during this period. So, it's a big problem. Now, if they want to balance their budget, the answer would be to cut Medicare and Medicaid to kind of keep up with this, but that's a lot easier said than done. Another adjustment with healthcare is as it pertains to inflation. So what happens is hospital budgets tend to be set in advance. And so when there's high inflation, the real money that they're spending is going to go down. Because if they say, we're spending $100 and, pricing triples, well, that $100 can't buy nearly as much as they could. So what happens is when there's higher inflation, spending is less than anticipated. So if we look here, the nominal spending was budgeted out by let's say the hospital. So between 2000 and 2001, spending, they expected the prices to go up by 5%, or by 5 points, and so they increased spending by 5 points. And so their real spending, they would buy the same amount. It was unchanged. They expected this trend to continue, so they set a budget of $110. But in reality, prices went way up. And so now that $110 wasn't able to purchase as much as they thought. And so their real spending went down. Right? So now they can set their budget again and they can readjust. And when they do that, then they can bring it back into balance. And if we look, this is in Canada, I believe. Yeah, so this is in Canada. And so you can see that as, during these spikes in inflation, because the budgets were set, they couldn't hire that many more nurses or healthcare professionals in general. And so healthcare spending became a smaller portion of GDP. But then when the inflation started to slow, then it became more pronounced. The third area to look at with adjustment is adjustment to GDP. So if you remember back to the first slide that we talked about with income and healthcare, so this looks at healthcare spending and income. So these are changes. So change in healthcare spending, change in income. And when you look at that over different years, you don't really see anything. There's really no clear trend here. But here, if we look here, we see more of a clear upward sloping trend. So what's the difference? Well, it's still looking at healthcare spending change, but now you're looking at income 3 to 5 years back. And so this is showing that slow adjustment to changes. So on years when, if there's a big jump in income, per capita income, right, it's going to take a couple of years for healthcare spending to keep up with that. Now, because healthcare spending tends to be steady, and because of the permanent income hypothesis and the income adjustment we talked about, it becomes very easy to predict looking forward. So when it comes to looking forward with healthcare, you can look at the past and current trends and figure out what's going to be going on going forward. And because of this slow adjustment, next year is likely going to be similar to this year with spending. Now, the further out you go, then it becomes more difficult because there's a lot of things that can happen that will affect healthcare. So, for example, in 2008, 2007, 2008, nobody knew that the demand for healthcare was going to be where it was in 2013 after the Affordable Care Act. So, looking 1 year at a time ahead, it's not too bad, but looking forward, that's when it becomes a little bit tough. Now, what has happened is that because of that lagging, it becomes difficult to balance a budget, especially with the government, and that slow adjustment leads to the government and employers to try to find ways to kind of bring down or to slow the growth of healthcare costs. And when we look at this, another effect is how it affects workforce. So as we mentioned, we talked about physicians and hospitals. Most labor or most cost when it comes to hospitals is for labor. The physicians, nurses, and other supportive staff. And unlike other industries, because of unions, because of the training, it is very, very difficult to hire and fire these medical professionals. And if we look over here, this is not very easy to see. Let's look over here. So, this shows the trends in healthcare, and you can see that healthcare, the percentage of health services professionals in general, right, has been increasing faster than the population. So its percentage of the total has been going up, right, which you can see here. Hospitals, however, have been going down as more has been going on in home care as advancements become better. And if we look again here, we can see, so this is since 1990. So here's the growth in, or here's the total number of, here's the total number of employment jobs, which you see really varies, spikes different points. You have the recession here. And here is the growth in healthcare jobs. And you see that goes up regardless. And so regardless of what's going on in the rest of the country, the healthcare industry has been growing. Now, if we look at this effect here, let's say there's a 1% increase in total U.S. employment. This shows the expected impact on healthcare employment in years after that. Where you can see in year 0, there's really nothing. But year 1, there's an impact, 2, 3, and so on. And so this just helps to illustrate the slow impact of it. And an example of this is Medicare. And so Medicare was enacted in 1965. And so with Medicare, elderly got their insurance, and so there's a lot more people insured, so a lot more growth in, a lot more growth in demand for physicians. And so in 1965, Medicare was enacted. It took 2 years till it was implemented, started to kick in, that you start to see the big increase in employment in that sector. And then that continued. It was pretty big for the first, over 1% for the first 3 years. And then it continued, although at a lower rate as it went on. So again, the big thing here to look at and understand is that this adjustment period when it comes to healthcare is slow. It's very slow because of the structure side, because of the revenue, and the cost side.